people. It is Wednesday. I don't know why I tell you guys what day it is because I'm sure you don't care. But anyways, today's topic will be orthodontic assisting versus dental assisting. So I'll go over the differences and some of the similarities of each of those. They're kind of the same thing. Orthodontic assisting is, pretty much a dental assistant because you're working with the teeth, but there's a lot of differences from orthodontic assisting to dental assisting. They're like two completely different jobs. So I just thought I would let you in on it and tell you the difference between them. So here we go. Well, obviously, orthodontic assistants, we work in orthodontics. Our main focus is straightening the teeth. And then a dental assistant, they work in general dentistry, and their main focus is overall dental health. So orthodontic assisting is what I do, and I want to say the main difference between orthodontic assisting and dental assisting is that you actually work in the mouth when you're an orthodontic assistant. When you're a dental assistant, you don't really use the instruments and use them in the mouth. So you'll pass the instruments to the doctor, but you won't yourself take the instruments and work in the mouth. Orthodontic assistants, we take the instruments and we do what the doctor needs us to do. So the doctor pretty much comes over, tells us, do this, this, and this. We need C-chain, we need steel tie, we need elastic tie, we need this wire, and we just do it. They really just come over, say what they need us to do, we do it, we dismiss the patient. So yeah, that's what I would say is the biggest difference. So being an orthodontic assistant, you're going to see your patients a lot more frequently, anywhere between 2 weeks to like 8 weeks. It's just kind of what we're doing and when the doctor wants to see them. 4 to 5 weeks is what we say a lot for our patients at our office. That's how frequently we see them. Dental assistants, they probably see them every couple months, 6 months, so not as frequent. And that's one thing I really like about orthodontic assisting. You get to see your patients more, and get to know them more, and just kind of catch up with them. So, and then obviously we get to see our patients by ourselves pretty much. Like I said, the doctor comes over and then they pretty much just leave and tell us what to do, and at that point it's just me and the patient, and we can just interact with each other. And yeah, so I like being one-on-one with the patient. I think it's nice. So being an orthodontic assistant, we show them how to brush around the braces. So we show them how to keep their teeth clean, their gums nice and clean, and a lot of kids have trouble brushing with braces on, or at least they think they do, when you really just need to go in circles. You're supposed to brush in circles if you don't have braces anyways, but a lot of kids will just go brush back and forth, and they're not going in circles to get up towards the gum, and they just miss above the braces, and then plaque starts to build up. And so we gotta tell them where they're missing and how to brush correctly, or else they will get scars on their teeth when we take the braces off. We bring patients back, so we're the ones that call for the patients, bring them back, sit them down, and get started on taking their ties off, and then waiting for the doctor to come over to tell us what to do next. Stock and order all of our inventory. So we need to write it down and we need to order it. We kind of do that. So yeah, that's just another job of an orthodontic assistant. Being an orthodontic assistant, you can also do lab work. I personally don't do lab work, but there's a couple of assistants that I do work with, and they also know the lab, so they know how to make retainers, palate expanders, and all that. So it's kind of cool to get to know that side of orthodontics and being able to make appliances and stuff. So being an orthodontic assistant, you know, since you don't have the doctor right there the whole time doing the work, you're actually physically doing the work. You need to be independent and flexible, and you know, make calls on things, so like have good judgment and like be able to figure things out. So as a dental assistant, you're chairside with the dentist and you're going to be passing them instruments. And I said that already, but that's like your main focus, is which instrument to pass. You know, sometimes our doctor will want to work on a certain patient, and being an orthodontic assistant, they'll want to work on a certain patient and we'll sit there and hand them which instrument, you know. So we both need to know which instrument to pass, and like what they're about to do, and kind of gotta read their mind. Another main focus for dental assistants in general dentistry is you will a lot of the time see them suctioning and doing the water for the patient. You know, rinsing them out and suctioning them. So, similarities of the two. We both take impressions. So, you know, the goopy, slimy, putty stuff that we put in a tray and then we put it in your mouth and it makes molds of your teeth. Well, orthodontic assistants and dental assistants both do those. General dentistry and orthodontics both need, you know, molds or impressions for something, so we both do them. Dental assistants and orthodontic assistants both sterilize the instruments and wipe down the chairs and get the chairs ready for the next patient. So we take the instruments, we put them in the sterilizer, and, you know, get ready to move on. Dental assistants and orthodontic assistants can take X-rays. So yeah, that's pretty cool. Both dental assistants and orthodontic assistants can, I believe dental assistants can do this, put patient needs or problems in their chart. You know, at least for us orthodontic assistants, like if someone comes in and they have a bracket off or there are wires poking them, we note that in the chart so that way the doctor can see it. I want to say dental assistants can do that, but I guess it probably just depends on the office, really. So, and then we can take records for patients. Also, I believe dental assistants can do this. I know orthodontic assisting, what I do, when someone's about to start, we take pictures of their teeth, take pictures of like their profile, their smile, and then if they need impressions, so we take records, you know, so they can start and we can get their treatment going. So that's pretty much it. You know, dental assisting is more just passing instruments and suctioning with water. Orthodontic assisting is more hands-on. You are with the patient, working in their mouth, and get a lot more like FaceTime with them. Not a doctor standing over you all the time. So I think I covered everything. Make sure you give this a thumbs up because I have a thrift store cap sweater on, and who doesn't like a good deal? If you like a good deal, give me a thumbs up. Yeah, I think I covered everything, and if you have any questions, leave them down below. Subscribe, give me some love, follow my Instagram, you know. I'll see you guys in the next video. Bye.